This is Dr. Sri Nagesh, a plastic and cosmetic surgeon from Ojas Aesthetic, Hyderabad. Uh, Today we shall be talking something about lipedema. What is new in lipedema research and technology? So now to understand about this lipedema, a lot of research is going on about this and how to diagnose lipedema, how to understand lipedema and other things, because lipedema is generally misdiagnosed as either obesity or lymphedema and treated as obesity or lipedema. And most of the people also are not aware of the fact that lipedema is a separate disease entity, and because WHO had classified this as a pear-shaped obesity for all these years, and only recently it has been segregated out of this particular subject, and it has been identified, and it has got its due recognition. Lipedema has got is basically diagnosed clinically, and there are no specific diagnostic tests per se to clinch onto the diagnosis and confirm that this is lipedema. It's basically most of it is clinical examination history, clinical examination, and family history. These are all the things that clinch the diagnosis. So, which is one of the reasons why even doctors have difficulty in trying to convince the insurance companies about this disease. And of course, a lot of work needs to be done in identifying this lipedema, educating lipedema, so that the awareness increases, so that the government understands that this is not a cosmetic problem, but it is a real disease, and insurance also understands that, and it is included as a disease, so that insurance cover the disease is covered by insurance. So now coming to the diagnosis, there are a lot of efforts being made to identify lipedema, and research, a lot of research has been going on, and the research has sort of come to an understanding, that there are a lot of genetic factors involved, and there are multiple genes that are responsible for this lipedema, and depending on the number of genes that are present in a particular individual's chromosomes, the disease flare-up takes place that way. If there are more number of genes involved, then the disease severity is more. If the number of genes are less, then the severity is less. So so there's no ballpark figure that okay, this many number of genes and this is the severity and all those things. That's still going on. And there, of course, there are a lot of hormonal influences, especially estrogen and progesterone, and which is also evident by the fact that lipedema typically occurs mainly in females rather than in males, and almost 10 to 15% of women across the globe suffer from lipedema, and so the fluctuations in the hormonal levels at various periods of women's life do matter, and affect lipedema. So typically lipedema starts at puberty. Till puberty, the girl is relatively normal, slim, and doing pretty well. At the onset of puberty, there are a lot of hormonal imbalances that fluctuations take place, and it triggers lipedema. And then, because of psychological impact and other things, the fat around the pelvis, hips, thighs, legs, the arms, and the forearms, they start to deposit excess amount of this lipedema fat, and it starts to grow. The chest, the neck, face, chest, and the waist remain quite narrow, but then it suddenly starts to increase at the hips. So, and also the more amount of inflammatory foods, diet, alcohol and other items consumed, high sugars um, and other things, also promotes and aggravates the condition. So now looking at the diagnostic tools, now ultrasound, there have been a lot of efforts being made to do ultrasound and try to identify between the normal fat and the abnormal fat. And MRI and lymphoscintigraphy are also aiding in the diagnosis and characterization of lipedema. Lymphoscintigraphy identifies the lymphatics. So a small dye is injected at the in the feet, on the dorsum of the foot, and then this dye is taken up by the lymphatic channels, and then it goes up to the inguinal nodes, and this is mapped, and the characteristic of the lymphatics is understood, but then it's a slow, a very slow process, and it's not very consistent uh, in the results so far. So still a lot of work is going on. MRI, on the other hand, is also, it tells you how much fat is present under the skin and between the skin and the muscle layers, so that we can quantify the kind of fat. And now there is a lot of work going on. The radiologist is trying to figure out how to qualify the fat, so that if you can identify, differentiate between the normal fat and the abnormal fat and what are their characteristics, those things also can be identified, and that would help in diagnosis of the condition. Now, surgical intervention is one of the only treatment which helps in controlling lipedema to a great extent. So, even in the surgical techniques like liposuction, there are a lot of research going on whether what kind of a liposuction is going to help the patient improve her condition, and how to reduce the risks involved, because along with so much of fat that is present, there's a weakness of the lymphatic system in the venous systems. There could be associated varicose veins, reticular veins, spider veins, which the spider veins can rupture during the process, leaving small peticle hemorrhages. The lymphatic system is weak, so there could be a tendency to form lymphatic lakes in the liposuctioned area, which could lead to large seroma collections of lymphatic fluid collection, which can also lead to skin necrosis and skin damage. So these all things, or repeated drainage of the lymphatic fluid, or the serous fluid. So these things, to reduce these things and how to improve the aesthetic results, just removing the fat alone is not enough for a woman. So along with removal of the fat, we also need to address the loose skin that is there. So whether just plain liposuction is sufficient, or any skin tightening methods need to be adopted to cause further shrinkage of the skin, so that you have tightness of the skin, avoiding skin folds and chafing, and due to rubbing of the skin. These things all need to also be understood. So in the long-term effectiveness of this particular thing, of this liposuction or excision process, has to be understood. Now, coming to the nutritional aspects and lifestyle interventions, the potential benefits of various diets and lifestyle modifications are being explored. So, what kind of a diet ideally is suitable for lipedema? Whether lipedema can be reversed using diet, can exercise help? What kind of exercise can either stall the lipedema or reverse lipedema? These are all things are also going on. Ongoing research is going on in those aspects. As of now, looking at the pharmacotherapeutics, medicines have no role in lipedema management, but there are certain kinds of medications like diuretics, or medicines which help in improving the blood circulation in the venous channels, like diasmin. These are have been found to have some partial benefit or temporary benefit in patients, but as such, these really don't help much. But also, there are investigations going on to at drugs that could target inflammation, because lipedema is edematous fat or or swollen fat. It's abnormal fat, and due to inflamed, it's an inflamed fat. So this inflammation, if you can control inflammation, maybe edema, the lipedema also can get under control, and this adipose tissue dysfunction can be also be addressed. So lymphatic abnormalities, how to improve the lymphatic flow and drainage. These are all research is going on all these things. Now, what is most important along with all this is patient education and support system. So, there's an ongoing effort to on with regard to patient education and trying to form lipedema communities. So, patients suffering from lipedema should, not hesitate to come together. Could maybe also meet up once in a while, address their issues, discuss with each other, so that they understand what difficulties each one is facing, and know what to anticipate, and know what measures to take to control that. So those clinics which are treating lipedema, I think the patients should try to interact with each other, and form a social group, get together at least once in a while. The doctors, the nurses, the dietitian, the physiotherapists, um, the gym trainers, you know, the personal gym trainer, all of them, the patients and the patients, along with the patients, should come together, have an interaction, and try to see that how things can be improved. Uh, so, as of now, all this is an ongoing research, and even the patients and their friends, family should come together, understand the condition, because lipedema is not an individual problem, but it is a condition that occurs in families, and when 10 to 15% of the population, entire population, is having lipedema, it is not an as an individual, one should not look into this particular thing. Everybody should, there should be an involvement of the entire society at large, so that things can come together, and we come across and do a give a better job, solution to the patients who are affected with lipedema. Thank you. If you have any questions, queries, you are always free to contact us at OJS Aesthetic, Madhapur, Hyderabad, or log on to www.ojasaesthetic.com or www.lipedema.in, and put your queries, and we'll be happy to answer them. Thank you.